All right, here they come. I'm not supposed to say anything till everybody's in the room. So I'm just killing time here,
Making small talk.
making small talk. Right. Nice.
I don't know that everybody's here until they're all here, though, so you
We
should.
won't. Yeah, we'll give them all a few minutes here. All right. Well, listen, we have about 20 people in the room, and there we go. There's 20. So now we can start. And there's 7 panelists. So, hello everybody. I am Dr. Veggie, Ted Barnett, the high-tech doctor with low-tech solutions, and I'm here on behalf of Rochester Lifestyle Medicine Institute with my co-host, Professor Lifestyle, Dr. Susan Friedman, who's a professor at the University of Rochester in the Department of Medicine. And I'm still not clear whether it's okay for me to call her Professor Lifestyle, but I don't give people a choice. So anyway, Susan, say hello.
Hello.
Okay, good.
Nice to see everybody, sort of.
It's great to have you here. And so we have an exciting webinar planned for tonight. And the inspiration of this came from actually our communication director, Robert Franke, who's behind the blue globe there. He said, we have some doctors who are able to talk to their patients and successfully get them to enroll in our whole food plant-based jumpstart. And so the question came up, it was, why are some doctors successful at getting their patients to participate in these lifestyle programs, and other doctors are still trying to figure it out. So we thought we would pick their brains, and not the best image. I'll try to come up with another image later. And so that's what this is all about. And I'm so excited that our panelists are here. First, I'm going to just have Susan tell us a little bit about herself, and then we're going to go around the room and talk to the panelists. So,
okay.
Yeah.
So I'm a professor of medicine at the University of Rochester, as well as the medical director at Rochester Lifestyle Medicine Group, and the director of clinical studies at Rochester Lifestyle Medicine Institute. And I've had the good fortune to work with Dr. Veggie for several years now, and I'm really interested in what everybody has to say today, because I have one of the things that I do is an inpatient consult service doing lifestyle medicine, and I find that it's a much tougher sell for patients in the hospital than once they come to RLM. And so I think it's other docs who tend to get our patients from there to here. And so I'm really curious to hear what everyone has to say. So.
Great, thank you. And just to, since Susan doesn't always toot her own horn, I will just also tell you that Susan has a special interest in healthy aging, and is a geriatrician, and is actually the lead author on the recent white paper from the American Geriatric Society on healthy aging. So that was great. Thank you, Susan. And how about Mira? Tell us about yourself, please. Dr.
Okay,
Agrawal.
hello. Thank you. Hello, everybody. I am Mira Agrawal, and I am an internist, and I'm also boarded in lifestyle medicine. I've been in practice about 25 years. I work with Integrated Health Associates, IHA. So I have a pretty large, very, very busy primary care practice, close to about 2,000 patients. So that's kind of my first and always love of clinical practice, where I believe I've been practicing some form of lifestyle medicine for all of these years. And so I'm really, really happy to now have fallen under the umbrella of ACLM to kind of help people realize what a significant kind of evidence-based, form of medical care this is. I also am part of the leadership team of the Division of Lifestyle Medicine at IHA, and Dr. Robert Breakey, who you'll meet, is my fearless leader. So we've been doing great work, and we're working on some pilots where we're trying to integrate lifestyle medicine into our own workplace. So we've been trying to effect change and create a culture change to have people healthier, happier, moving more during the workplace. And that has been very, very successful. It's coming to fruition, and we're hoping to launch organization-wide. And then the third thing that I do is I'm on faculty at our local hospital, St. Joseph Mercy Hospital, where we have launched a lifestyle medicine program kind of internally. And we have some very, very enthusiastic residents. So I'm kind of the lifestyle medicine lead faculty, and we've just developed a program where they do, I work with them in their clinic, kind of showing them how they can practice medicine through the lens of lifestyle medicine. And it has been extremely rewarding. These are the young future docs of the generation to come. And I'm just so excited because if we can get them on board, we'll have a whole new wave of making lifestyle medicine much more mainstream. So I'm very, very excited about all of this, and I'm looking forward to this talk today. Thank you.
Great, thank you very much. And Dr. Leibman, Scott Leibman, also from Rochester.
Hi, yeah, my name's Scott Leibman. I am a nephrologist actually, and I work with Susan and Ted sometimes at Rochester Lifestyle Medicine. I've gotten involved there. I work at Strong Hospital in Rochester, so in an academic setting. I've been drawn to lifestyle medicine just because after practicing for a while, I realized that, you know, not everything I tried to do with my pills and potions and tonics has worked the way I would like. And in doing my own research of stuff I did not learn in medical school, I've learned that lifestyle medicine in terms of diet and exercise and all the things we talk about really does have an outsized effect. I did take my interest to get boarded in lifestyle medicine, and it's a little bit hard in the academic setting, and I'd love to learn from my co-panelists, but I try to introduce it with every patient. One of the other things I'm really excited about, we've been working with Rochester Lifestyle Medicine in a very small pilot project, just looking at specifically patients with kidney disease, the effects of the lifestyle medicine program in terms of educating them about a whole food plant-based diet to see if it affects blood pressure, and more importantly, to address the issue of potassium, which seems to scare a lot of people away in kidney disease. So we're hoping to get some pilot data and then possibly take it further from there.
Great, thank you. Thank you, Scott. And before I forget, if people have questions, they can please put them in the chat. We're going to use the chat instead of the Q&A, just because we can see it more easily. And Dr. Sundermann from Michigan.
Hi, Melissa Sundermann, and like Dr. Agrawal, I am board certified in internal medicine as well as lifestyle medicine. Been in practice for about 23 years. I am a DO, so I think that when I was in training, sort of from the get-go, was thought to think a little bit more holistically and the body as a system. And so always felt that near and dear to my heart. And so when I was working at the University of Michigan, I had the opportunity to do a year-long faculty scholars program in integrative medicine. So I was introduced to alternative ways of healing and was able to, become knowledgeable that there's more to healing than just pills. Took that a step further and did the professional training program in mind-body medicine with James Gordon, who spoke at the ACLM conference last year. And so again, going along this journey and feeling like I couldn't really find my right home until 2019, when I found the American College of Lifestyle Medicine and felt like this is what my belief system has been both personally and professionally all this time. And now I have a body of practitioners and evidence, and it really feels like coming home. So I'm part of IHA, the same group as Dr. Breakey and Dr. Agrawal. And it was the universal aligned that I ended up coming to their practice just as they were getting ready to really fully launch the IHA Lifestyle Medicine Institute. So we're hard at work and we're getting ready to launch our lifestyle medicine consult service. So that's hopefully up and running later this month. So just great opportunities, and 23 years into doing this, and I've never felt so invigorating that I can offer something truly healing to my patients, and change their life. So that's really rewarding. Fun tip about me is, as my partners know, exercise is a very important pillar to me, and I'll be running my 10th Boston Marathon this October. 25 years after my first Boston Marathon. I was a second year med student when I ran my first. So it's pretty cool to be still running 25 years later at the Boston Marathon. So that's a fun tip about myself. So thank you for having me today.
Oh, it's a pleasure. Thanks for sharing that. And I have to say, I'm surprised that it's only been since 2019 that you were at ACLM, because it seems like you've been here forever.
I told you, I found my home.
That's great. All right. And now, Dr. Breakey, and also Dr. Breakey, if you could just explain to people in the audience what IHA is.
Yes, thanks. Thank you, Ted, for having me here. Welcome to our audience, and thank you for joining us on this, what in Michigan is a beautiful summer evening. I'm actually a fifth generation graduate from the University of Michigan. My great-grandfather graduated in 1859. All there was lifestyle medicine. They didn't have all these pills and surgery. So they kind of think in terms of the Hippocrates mode of let food be thy medicine, heal the injuries, work with people. My great-grandfather started the Department of Dermatology at U of M. Both my grandfather and dad were urologists, and I reversed the trend there and went back to primary care as a lifestyle family physician. I've been plant-based myself now for 44 years, and in the early days it was kind of tough going. There wasn't much to eat, let alone a lot of information and evidence-based approach to all this. But what I can say is now so much more out there, so much more data, evidence, information, both available to patients on the internet and to our colleagues ourselves to be able to present to them an approach that gets to the root cause, that helps empower them to literally turn their lives around. And as Melissa mentioned, and as I know we can all attest to, that's what really brings that joy of medicine. And a quick story on that, doing a Medicare wellness visit just a couple of weeks ago, my MA comes in and says, well, she doesn't think she really needs to see you, she just wants to say goodbye. And I said, what? And I walk in, here's this patient I'd known for 30 years. She said, Dr. Breakey, it's my last visit because I'm moving to Traverse City, but I just want to thank you. She said, about 30 years ago when we met, you inspired me to go plant-based and to live a healthy lifestyle. And here I am, 68, and I'm normal weight, and I'm on no medicines. I've got no medical problems. I get to go enjoy life with my grandchildren and retire in Traverse City and garden like I love. She said, I just want to thank you. You gave me a better life. And I said, well, Alice, you did the work. You did it. I'm glad I inspired you to understand that this is what's possible. And that's what, again, really brings that joy of medicine back home. And now, and again, I'm sure we'll get to this, but having a turnkey program like Rochester Lifestyle Medicine that truly helps people to experience it for themselves in a non-pressure situation that helps them to enjoy the food at the same time, learning about how, not only the why, but the how, that has been a great asset to my practice and sharing it across IHA. And now, Ted, your question, IHA is a medical group centered in and around Ann Arbor, started 26 years ago and has grown from initial 37 docs up to over 1,000 providers now, and almost all specialties covering
Uh-oh.
500,000
Just me, or did
patients.
he freeze?
Oh, it froze.
Did I?
Yeah,
Oh.
Go back about 10 seconds.
My
Please.
power is going.
Oh,
My
it's your
power is
power.
going off and on. Am I still frozen?
No,
No,
you're
we-
here.
No, you're good.
You're moving now. I see
Okay.
your delightful smile.
Okay, thank you. So the Jumpstart programs allowed me that turnkey referral to an evidence-based approach that helps patients to get it going with the why and the how, to make it fun, to make it engaging, non-pressured. And multiple patients I've referred have come back and said, well, thank you so much for that. With respect to IHA, we started 26 years ago with a merger of 3 primary care groups and have grown to over 1,000 providers now, and covering 500,000 patients in the greater Ann Arbor area. And it developed in the last 3 years this division of lifestyle medicine. As Mira mentioned, I'm the head of that, the medical director, and we plan to bring lifestyle medicine to our group and thereby the example they set to the patients we serve. Not just plan to, that's what we are doing, and appreciate the partnership with RLM that has allowed us to accelerate those efforts. So
That's great. Yeah. Oh, thank you. And I do see there's a hand up in the chat room. We're going to get to the hands, I promise, in a little bit. I've got a couple of questions that we'd just like to go through, though, first. How do you talk to your patients about nutrition? Let's start with Dr. Agrawal. How do you talk to them
Okay.
about that? And kind of in the same question, how do you identify patients who are open to making dietary changes?
Okay. All right. That's what it's all about, right?
Yeah.
So I think that one of the things that is really key about nutrition is that it's a very personal and emotional topic. Something that, we grow up as children and our parents give us what they believe is the best, right? So we have this mindset that we were raised being fed by our parents, right? They're not going to give us stuff that is harmful. So we have to be very, very mindful of that and to like really, really walk on eggshells when we broach a subject like that. And so I find that it's very, very important to get to know my patients as individuals. I try to find out, what their likes and their dislikes are, like their ethnic background matters tremendously, right? Every ethnic culture has their own type of foods and, sometimes it's extremely different and polarizing, and what one person thinks of as healthy, another group does not. And you can't just turn around and say, oh, this is wrong. And it's all about how you're going to gingerly approach that. So I kind of use a twofold approach as I get to know them and, connect with them, find out if they like food. Some people love food. Some people just eat because they have to, right? If they know how to cook, if they love to cook, if they just want to get takeout, you have to kind of like keep moving further and further down the line. And then one of the big things, obviously, why they're there is very often they have chronic illness, and then they always talk about family history. And that ties in very nicely for me, right? Because they believe that, oh, this runs in my family, and everyone in my family is diabetic, everyone is hypertensive. And that's where the evidence part of lifestyle medicine comes in. And I can educate them and I say, hey, are you aware that your genome is literally about 15% of all of this, and the rest is all epigenetics. And it's based on your own lifestyle. And so then one of my favorite phrases I'll say to them, I'll say, well, you didn't just inherit your grandmother's genes, you inherited her lasagna recipe. And so, and I'd modify the food to each ethnic group. It can be falafel, it can be, whichever thing that, whatever their background is. And I think that phrase, I kind of somehow came up with it one day. And I think it really hits home, and it kind of makes them understand that a lot of these are learned behaviors. And so then they're kind of open to perhaps unlearning, right? And so then we have a bit of a talk about portions and about, the food industry a little bit. And if they are interested, then they start to engage, and then they like hook on to one or two facts, right? So once I find that they are interested in asking questions and engaging, only then do I start to make recommendations, because I found that just talking down to them is very, very difficult, right? Like nobody really likes that. No one likes to be told, oh, you're completely wrong. And so, and I share, I'm pretty comfortable sharing with them about my personal journey with food and how, I went from, I was raised vegetarian, then I started to eat meat. And then, gradually in the last few years, I've also become completely vegan as well. And I share with them what my own likes and dislikes are, because a lot of the whole plant-based thing, to get people there, very often there's that kind of Western diet mentality of a pile of like boiled peas on the side of your plate, right? Or carrots or something. So I just say to them, I'm like, you would never be able to get me to eat that because it's disgusting, right? And so then they laugh some more, and then we kind of move into this whole journey of, okay, what, one thing at a time, what can you give up? What would you be interested in? What do you think might work for you? And then we kind of slowly chip away at it. So, and when I think they're ready, which very often as I give them various resources to go home and think about and talk about, and I will say I have had tremendous success with the Jumpstart program. I've had a really, really super response. And again, when I talk about myself, I actually share with them that I took it myself. You offered it to us last summer and I was very excited to do it. And I tell them, anybody can do anything for 15 days. And, even if you walk away with something, with a small something that starts you on your journey, that's fantastic. So a lot of listening, a lot of getting to know people, a lot of connecting, and then finding where they're at. And then, some people want to dive in, it's like the smoking thing that I do with people as well. Some people want to quit cold turkey and do it 100%. Others need to do it gradually. So just figuring out who they are and how they want to have their journey.
Thank you for that. And actually, you answered our last question, which would be, what would be your one pearl of advice to other clinicians? And
Yes.
that little quote you gave, you didn't just inherit your grandmother's genes, you also inherited her lasagna recipe. I think unless you have another really great pearl, we're gonna count that one as your pearl.
Okay, you can count that one.
Okay. Okay, great. Excellent. Susan, did you have any questions?
No, I think that was, great. You covered a lot of ground. But I think, patients are so variable, right? And they, as you say, they come at this from so many different places, and just trying to understand them first, really, I think, to me, that's a pearl, is understanding them first and then making a recommendation second. So
yeah, thanks. Dr. Sundermann,
Yeah.
how would you answer the same question? How do you talk to your patients about nutrition? How do you identify patients who are open to making dietary change? And if you have a pearl, you can share that
So
with us.
I think that Mira did a beautiful job with that. And I think that I approached it very similarly. I'm going to highlight what I actually do in my exam rooms to even spark the conversation. So I have a wonderful medical assistant who, I sort of have run along with my journey of lifestyle medicine, and she's totally on board and happens to be very creative. So we have, instead of in our bulletin boards, and we work in a pretty traditional primary care office, we've created lifestyle medicine bulletin boards. So we've decorated them. We've got testimonial stories and pictures and recipes and forks over knives stories. And I've got some pictures of me being outside or with my dogs. And so that sparks an interest when they're waiting for me to come into the room. If it's a new patient or if I'm seeing someone else's patient, they're kind of curious, like, what, Dr. Sundermann lifestyle medicine? I've never even heard of lifestyle medicine. What is this? So that's been a wonderful addition, and it definitely sparks an interest and an opener for conversation. And I agree with Dr. Agrawal about the stages of change, right? So we've got some patients that are just pre-contemplative, like they don't even understand or realize that the standard American diet may be detrimental to their health, right? It's what they have grown up with. It's what their overall lifestyles are. So I think it's meeting patients where they're at. And I think my clinical pearl is that I think we shouldn't underestimate our patients. And I think that when I was going through studying for my boards, and other physicians would see me studying and reading this book, and I would explain a little bit what it is. And some physicians would say to me, patients are never going to change. Like, why even waste your time? They're not going to do that. They just want the easy fix in the pill. And I said, I don't think that's true. And so I think it's really, first of all, I needed to have the education, the proper education, to be able to give this information to my patients. And really with nutrition, what I will say is that even to this day, physicians are not trained in nutrition, right? When we think back to medical school, I think the average was 17 hours throughout medical school and residency. And most, maybe not even that, Bob. And most of that is, we memorized the Krebs cycle, right? And we learned about Kashi-Walker and rickets. And like, I've been practicing for 23 years, never seen any of those, right? But that's the stuff that we learned. So I thought I knew about nutrition, right? Because I'd say, eat clean, eat, lean protein, right? Because I was just learning it from whatever I would hear or read. So I never took that deep dive. So now that in preparing for the lifestyle medicine boards and then doing so much, more research on my own, I feel like I have the tools to properly educate and dispel a lot of myths, right? And so believing in our patients and then also practicing what we preach. And I think that we as lifestyle medicine practitioners, we self-select, right? Because this is what we truly believe in. And, I tell my patients, I'm not perfect. No one is. But I try to do my best to live up to these 6 pillars as best as I can. And it's not perfect, but I would be a hypocrite if I'm telling you to, try to eat as many plants as you can or get as much fiber, and then I'm chomping on a Big Mac in the back, right? That just doesn't, fit. So I think in being honest and like Mira said, is, telling your own story, right? And I'm not like Bob. I haven't been a vegan for 44 years, but I am now because I just didn't know, right? So meeting patients where they're at, making small changes that they feel confident they can do, so whether it's doing more of the good things, like a lot of times I'll say, do you like fruits and vegetables? Well, yeah, I do. Can you do more of that? Oh, yeah, I can do that. Okay, let's, because that's you want them to feel confident that they can do it, right? Or maybe it's, do you drink milk? Well, yeah, of course I drink milk. I need the calcium. Well, okay, well, could you maybe switch to a plant-based milk? And so starting off with some really small, achievable goals that they can feel confident that they can do is really where I start, right? And then in trying to provide education, because I didn't know it, and I was a physician and I thought I knew everything about nutrition. So, our patients, they're swayed by the media and what they see in commercials and what they read. Time magazine has a special issue about, how to manage your weight. And I flipped through it, right? It just came out and I'm like, no. No. So this is what everyone is reading. And I'm still learning, right? So it's just believing in my patients, trying to have them have success, right? And meeting them where they're at.
Beautifully said. Thank you.
Yeah.
This is just go ahead, Susan.
Sorry, I just want to pick up on one of the things that you said at the very beginning, which is not underestimating our patients. And I think, one of the things that we kind of get into this vicious cycle with is that, none of us were trained in medical school about nutrition and the value of any of these lifestyle pillars. And then, so what we're left with is telling patients, well, eat well, exercise, and we don't know anything about counseling them in terms of behavior change. And so they end up not doing it. And then we say, well, it doesn't work anyway, right? And so it becomes sort of this perpetuating cycle. And but if we know how to counsel them, and we really know the value of what we're telling them to do, then I think people are willing to make changes, and especially if they are sick. I mean, so many patients come in and they have these terrible chronic diseases, and they're willing to make substantial changes in order to address those issues. So,
Yeah. And Dr. Friedman is speaking as a hospitalist as well, so she does. Yeah. There's a real quick question that we're going to take a break for, because it says, I think this is for Mira. Can you repeat again the stat you mentioned about only 15% inherited? I think that was Mira, right?
Yes, it was me. Yeah, that's true. A lot of research has been shown, like the newer research that's coming out. I think Dr. Dean Ornish has published some, and I think it's Walter Longo as well, who's been doing a lot of the epigenetic work.
15% of what is inherited?
Of the genome is actually in directly, like all of the hereditary kind of health issues, right? Like heart disease, diabetes, hypertension, where high cholesterol, where you hear that a lot, I'm not talking about like hereditary polyposis and that kind of thing, which is an autosomal dominant. I'm talking more about like the day-to-day lifestyle diseases, the chronic metabolic syndrome type diseases that, people believe are over 50%, 80% running in the family, and has been completely debunked.
Great, thank you for clearing that up. And then there's, I'm going to call on Dr. Leibman now, and I'm going to combine that with a question that's in the Q&A, and because you're a nephrologist, and so we're going to ask you to talk. How do you talk to your patients about nutrition? How do you identify patients who are open to making dietary changes? And can a patient's kidney function that's bordering high for many years be improved with a whole food plant-based diet? And I guess this specific patient that she's talking about, because the patient is otherwise relatively healthy. So the question is, can kidney function that's bordering high be improved following a whole food plant-based diet? So 3 questions for you.
Thanks, Ted. Well, I will say, after listening to my co-panelists to the question of how do you talk to your patients about nutrition, my answer is I wish it was better, because I think everything they said is wonderful, and I certainly could not be as eloquent, and I agree with all of that. One of my concerns and one of my obstacles is, when I'm seeing my nephrology patients, I don't always feel like I have a ton of time, and I'm sure everybody else feels the same thing. So I really just try, like was said, I really try to just plant the seed, no pun intended, with each visit. And one of my pearls definitely would be, if I don't have the time, or even if I don't have all the counseling experience that I'd like to have, is leverage your community resources. So I use Susan and Ted quite a bit. If people show any sort of interest, I will say, hey, I know these folks who really specialize in this sort of thing, and they will be more than happy to talk to you and get you all the information you need. I think the other thing that I sometimes deal with is seeing patients with kidney disease. I mean, everybody goes on the internet and does research. So I have people already coming in telling me that they have to restrict potassium and have to restrict phosphorus, which, for the vast majority of the people we see just isn't an issue. So that's one thing I try to correct them in. And in terms of the question of kidney disease, that's a great question. My gut feeling, and I'd love to be able to say yes without a doubt, but I truly do feel that certainly if people have a more healthy lifestyle, I think I'm going to cop out a little here. I think it's feasible that we could see some improvement in kidney function, because we'll certainly see improvement in some of the risk factors like high blood pressure and diabetes. That being said, I have to give one caveat and say one of the holy grails that I would love to see in my lifetime is some sort of evidence to show that's the case. We don't have that yet. There are a lot of case reports out there. So I guess I would say I can't give a yes officially, but my gut feeling is it probably is something that we could see. Is that fair, Ted? I'm trying to hedge so I don't get quoted.
Sure, that's fair. It sounds like the punchline to a joke, which is it couldn't hurt.
No, we definitely have seen people show improvement, but again, you can't.
Sure. Sure.
I think it truly can help, but I can't go out there and claim there's great randomized controlled trial evidence for that. But
right.
But my answer is yes. I think it will help.
Very good. Thank you. Now on to Dr. Breakey. Any pearls, and how do you talk to your patients about nutrition? How do you identify the patients who are ready to make the change?
Sure. As our other panelists have described, I think one of the key principles is assess readiness. There's no one way to approach a person about talking about nutrition. And components of that include, where are they starting from? It may be that they've just had a teachable moment, a prostate cancer diagnosis, or a recent minor stroke, or a uncle that just died of a heart attack suddenly at 57. All these things can be times where they'll say, oh, okay, tell me whatever and I'll do it, versus the person with no current issues and not a lot of incentive. And again, I think you have to approach those folks differently. It also is a part of what are their goals. And that's where I talk about my experience. I turned 65 a few months ago, and I still like to. I just went scuba diving last week in the Bahamas. I went down to 100 feet and saw a shipwreck. I do the flyboard and the roller blades. I can't keep up Melissa and marathons, but I ski fast. I be active, and without my health, none of that would be possible. And so I try to say, what are your goals? What do you like to do? And maybe it's as simple as go for a walk with the grandkids, or be able to get off their medications, or lose that 10 pounds before their daughter's wedding this summer. And that gives me that lever, like, okay, how do we then turn that into intrinsic motivation? How do we inspire them to want to do it, instead of saying, here's what I'm prescribing you have to do? Because as was mentioned, it just doesn't work. People rebel from that. There's a natural instinct, as opposed to, wow, I want whatever you've got. And sharing from your experience helps them to understand that, okay, maybe there is a better way. Another tool I use, I'm sure many of you have seen, if you Google your last 10 years on YouTube, or not Google, but search it on there, you'll see a little Canadian public service announcement with a split screen, and there's the guy, it's the same actor, but on this side he's vibrant and riding bikes and playing with grandkids, and on this side he's in an extended care facility, getting turned to prevent bed sores and with IVs going. And it kind of says, what will your last 10 years look like? And I literally pull this up and show it to patients, and they're all like, some of them get a little clutching their chest like, whoa, my uncle was that guy on the right. I don't want to be that. And I remember, my neighbor was that guy at 90. He was still riding his bike. I want to be the guy on the left. And then like Mira, I say, well, good news. It's not just a matter of chance or bad genes or other. It's largely under your control, which guy you're going to be during your last 10 years. And that then again gives that sense of, okay, talk to me, let me know what then it is. And I got my handout called Dr. Bob's 8 Keys for Health, and I provide them circle resources, watch these videos, let a third party do some of the heavy lifting. So once they've watched Forks Over Knives or done this amazing Jumpstart program, then all I have to do is come in and kind of play motivational sustainability. You provide people with those resources so that they learn it, develop that intrinsic motivation. And then again, they then come back like my patient Alice did and thank you for it and say what I want to do, share it with their friends, family, and others. And suddenly a practice grows to a group of people who are looking for that kind of fun, and knowing that you're really making a difference in people's lives.
That's great. Thank you, Dr. Breakey.
Finally, one more thing.
Your pearl. Wait, what's your pearl?
One more thing. I have had patients with improved kidney function. So I agree with Scott, although we have to be careful. There's no big studies on it. We've seen it happen. People, they better perfuse their kidneys. They decrease the inflammatory and metabolic acidosis that provided by a standard American diet. And their kidney function, like their lung function, like their heart function, like their brain function, like pretty much every other function in their body improves. Now, what you can't do is regrow nephrons. And once you have, just like in COPD, you're not going to regain those alveoli if you destroy them. So the sooner the better. And the more you do, the more you gain. But if you're out there with borderline low kidney function and you want to maintain that, absolutely go for what makes a difference. And I guess my pearl is one of my favorite quotes. It's if you have your health, you have 1,000 dreams, and if you don't, you have just one.
Wow.
So choose health.
Yeah, choose health. Okay.
Hey, Ted, could I just add one more thing?
Absolutely.
So, in terms of kidney function, we talk about improving kidney function. I mean, oftentimes as nephrologists, we're happy if people's kidney function stays the same. I mean, we don't want it to get worse. And there is actually randomized controlled data out there that a diet that just has added fruits and vegetables. This wasn't even a completely plant-based diet. It was just a diet that adds fruits and vegetables. It actually did lead to preservation of kidney function over following a typical diet. So that there is data for. And I don't think we trumpet that enough. So that's just adding fruits and vegetables. I can't help but imagine what would happen if you went, pardon the pun, whole hog, so to speak.
Right. No, that's interesting. Well, thank you for that. Yeah. Okay, good. I'm just going to back up for a second and let the audience know that we've got 26 people signed up who are actually in the room with us, in addition to the panelists, and they're from 17 different states. That's tonight, so that's pretty cool. And there is a hand raised. Looks like Nancy Brubaker has her hand up. And I don't know if you want to leave a question in the chat or you want to go ahead and talk. We can hear, I think we can unmute you. And my notes tell me that Nancy is an RN nurse health coach.
Oh, awesome.
Nancy, you're on. Would you like, you have a question?
You need to unmute.
Oh yeah, she needs to unmute herself. Bob, can we tell if Nancy's there or not?
I did ask her to unmute.
Okay. All right. Well, we'll wait for we'll come back to Nancy if she figures out the buttons. What about any particular resources that the panelists find particularly helpful when they're talking to their patients? Anybody have favorite resources? Raise your hand. Okay, Dr. Agrawal. Yeah.
I like to keep it simple. And again, you want something catchy and interesting because you don't want to just keep talking at them. My favorite one lately is the movie, The Game Changers, everyone has Netflix, everyone's been trapped indoors. So everyone's been like binging on Netflix. So just suggesting that, I like the fact that it's geared towards like athletes and really very much a male audience too, because that seems to be a stumbling block in families. Oh, my husband and my boys, they want that protein, they want to work out, they want to, so that's a very nice kind of way to sort of say, hey, go home, all of you just watch this together and then think about it. I also really love the Nutrition Facts website that Dr. Greger has going, because it's so evidence-based and it's so broad. And then I also really do like Dr. Ornish's work. So I recommend The Spectrum and Undo It, and he also has a lot of like YouTube videos, because you want to keep it like just some sound bites, not overwhelm them too much at the very beginning. So if they're working on weight loss, I'll suggest How Not to Diet by Michael Greger, because he's got all those pearls and he covers so much. So just depending on what they want, if they're more like, the type who like to read, the type who like to watch movies, the type who like, websites, I use those as options.
Thank you. Anybody else have a favorite on the panelists? Any favorite?
Yeah, I can chime in, and I totally agree with Mira. And I've been Game Changers has been a great hit. Of course, Forks Over Knives, right? That's one of our classic ones. So I think that when I'm presenting this information, what I like to say to my patients is, affirming that they are intelligent, they know their bodies the best. And so, what I say is I'm going to provide some resources so you can go home and you can, no pun intended, digest this. So in addition to the Netflix, I have a picture of Dr. Michael Greger and myself, holding How Not to Die. And I say, this is what really changed my life, right? And I listened to it on Audible because he reads it himself. And he is, as we all know, Dr. Greger is a very exciting speaker. And so I share my own personal story of transformation. I also have a list of podcasts that I have collected, because still to this day, I probably listen to a podcast episode, most days. I have a commute to work, and then I like to run or take a walk. And so I've created, we're on the Epic EMR, so I created a smart phrase that I can just pop in, to their handout. And I say, just listen to some of these, and they're free. And I learn something new every day. So I found that patients are really receptive to podcasts. And then
do you have favorite podcasts?
Well, I've got many. So I love The Exam Room, of course. Chuck Carroll does a wonderful job. I also love.
And The Exam Room that's Physicians Committee, right?
And then Lori Marbus does a wonderful with her Healthy Human Revolution. She is great. Plant Trainers with Adam and Shoshana Chaim, wonderful as well. And then Rip Esselstyn, his Plant Strong podcast. Veggie Doctor, not you Veggie Doctor, but Dr. Yami, she's a pediatrician. So she does touch on whole family and pediatric age, but also, adult health as well. And then Rich Roll is wonderful. He's been on the podcast scene for a long time, and he himself is a long time plant-based, and he's an endurance athlete. So he brings on both lifestyle medicine as well as athletics. So those are my kind of top choices. And so I find that patients are really receptive to that. And then I have a grocery list. Usually I'll send them home, just because patients, a lot of times they just don't know. And so I say, would you want a grocery list? And, Ted, you guys have your own grocery list, which is great because it divides it into the grocery store as you're walking through. So I have that copy. I have another PDF of a grocery list that really shows, it's like 5 pages. So it really shows patients, you can eat. I'm not putting you on recommending anything restrictive. There's so many options. And so I take home this grocery list, maybe sit down with your family, highlight things that A, you already are doing, or B, you're thinking, oh yeah, we can do that. And I say, everything on here is green light. So if you could just do a little bit more of this, that's great. So those are some resources that I, use pretty much every day.
Thank you.
Ted,
Yeah, go ahead.
let me see if my share screen works. I like this handout from the American College of Lifestyle Medicine. and it's not coming up on my screen share here, even though it's over here, but it's a whole food plant-based. Oh, can you see it? No, yeah. Whole food plant-based overview. And I say ACLM is the physician or provider organization that really takes an evidence-based approach. And it shows a plate with a whole food plant-based approach, and then some tips for getting there. Once
There you go.
again, sorry.
There you go.
Bob, what's it called?
Now you see my screen.
Yeah.
There, yeah,
there it is.
ACLM, whole food plant-based plate.
Mhm.
You see the plant proteins, fruits and vegetables. It's kind of a familiar concept for people. Have fruits and veggies, drink water, whole grains. It gives a chance to talk, add some herbs and spices. And then on page 2, it really gets into a little more of the kind of positive approach to how to take your journey step 1, step 2, plan ahead, include the family. It's all very positive, no making wrong about what they might be currently doing, but rather helping people to kind of see, hey, I can do this. And also adding that credibility of a national organization that's not just a handout from the co-op, but rather what is an approach that can help you to improve. And again, like Mira said, keep it simple. It's just a front and back page. They can take it home, read it, kind of share it with friends. And in addition to that, I do give them, again, everybody learns in different ways. So whether it's listening, reading, or watching documentaries, you give them resources that will match their style of learning. And then again, I think as Scott said too, take it a piece at a time and then ask them again on the follow-up. How'd that go? Do you have more questions? Did you like the documentary? Did you watch it? And work with them to make incremental progress at each step.
Right. And Bob, where do people get those handouts?
Oh, that's through ACLM. I just order, they do charge a fee, but they're very professional, glossy. American College of Lifestyle Medicine. If you're a member, you get a discount. Go on and just order them directly.
Sure. I think you can also go and download the PDFs, I believe, of those.
Yeah.
Right? So you can just go to the website and poke around and see if you can find those, because they are great. We do have a question here. So for those of you who've had patients go through the Jumpstart, this is from Dr. Berkowitz, who I believe is a nephrologist. If a patient completes the Kickstart program, what do you recommend for intensity of follow-up? So how often should you see the patients afterwards? When should you see them after the Jumpstart? Dr. Sundermann or Dr. Agrawal, you both had a lot of experience with Jumpstart. What do you think?
Yeah, so I'll start first and then you can take over,
Sure,
Mira.
go ahead.
Yeah, so I was just telling the panelist group, I had 2 patients today that just completed Jumpstart. So, and 2 probably women in their 60s. Again, this is just about, it's never too late, right? So these 2 women, one of them hypertensive, pre-diabetic. I think they both were along that continuum. And we started out the conversation, they wanted to learn more. And I think where Jumpstart is so instrumental is a lot of people get overwhelmed. Where do I even start, right? And that's where your program is just superb. And they had such great things to say about the program. And what one of them said was she knew that another one of my patients was in her cohort. And she said, I know you're kind of not allowed to do this, but could you give her my phone number so that we live in the same city so that we can keep going on this journey together. So I think that one of the ways that people can keep doing this is just kind of forming those friendships or relationships and to empower each other, right? And then to have, a support system built in. But, for these 2 patients that I saw, they are launched, right? And one of the patients, we did labs 3 weeks ago and we just repeated them. And within 3 weeks, she dropped her LDL by 11 points, right? So she felt really proud about that, dropped her A1C. So, the proof is in the vegan pudding that in this program, quick results, right? But sustainable. So I offered to them, both of them, I said, if you want to come back and see me, for a check-in, in 3-4 weeks, just to sort of touch base, see how things are going. And I think that's, it's going to be individualized. Some patients are going to be like, I got this, like, woohoo, like I'm good to go. And then other patients are going to be like, well, I kind of think I know what I'm doing, but, I maybe want to just check back in with you. And again, to just fine tune things and just have that support system that they have a cheerleader along the way. But I'm really excited for these two patients to be able to click together, and to go on their journey of vitality together.
Thank you for that. Yeah. Dr. Agrawal, you wanted to?
Yeah,
say
so
something
I think, very much similar to what Dr. Sundermann said, it's very individual, and I have also had tremendous success. I have had a handful of people who don't like it so much, and that's just human nature. But I think to specifically answer Paul's question about, like follow-up, again, some people really feel that they're capable and they're doing great. I think doing the follow-up lab work is so helpful because it really reinforces, look at the difference that you made. You did this hard work for 3 weeks and look what an impact there was. Like I've had people drop their A1Cs by close to 1 point. I've actually had total cholesterols drop by over 100 points in the 3 weeks. It was unbelievable, like really, really remarkable. So some of them, when it's kind of like iffy, I will have them come see me when they're done, like within a couple of weeks. And I generally like most of them to come and check in within about 3 months. I find that that's kind of that final kind of buffer zone, because after that, they're just going to forget, life goes on and they're just moving on with their life. And so 6 or 8 months, 1 year later, suddenly you've forgotten and you can undo a lot of it. So I think that 2 or 3 month mark to kind of reinforce all of that is very, very helpful. So specific to that though, like I have a couple of things. So one of the things that I really try to explain to my patients through myself again, is how it's not so much about giving things up, but just change, evolving. And I really tell them that their taste buds will change, that they will kind of suddenly acquire new tastes and flavors that they never had before. It's almost like a smoker stopping smoking and suddenly they can smell and taste again, So the same way, like I tell them, I'm like, you're not, believe me, like a couple of years from now, you're not going to miss this. You're actually not going to want it at all. You're not going to want to eat that stuff, and you'll actually enjoy so many more flavors and you'll actually like cultivate these really, really good. And that's what I love about your program is that I tell them, I'm like, you guys need something to show you what is out there, right? It's not just a side of boiled, steamed vegetables. There's so much food out there, like so much, and I about my own family a lot. Like, I'm of Indian heritage. My husband is born and raised Irish Catholic, from a family of meat eaters. And he has now like jumped completely on board. Like we traveled to India several years ago and my entire extended family there is pure vegetarian. And so he never had a speck of meat and he put on like a ton of weight. He loved the food. He had such an assortment of dishes. He had no idea what half of them were and they were all delicious. So it's all about just exposing people, to the different flavors and the tastes and everything else. And so just offering it up and sharing that. And then just one patient story, just kind of like Melissa had, it's so nice and it's so rewarding. I had this Italian husband and wife couple that I take care of. And I think it was the husband who's been struggling with high cholesterol and hypertension, just, kind of at that borderline and just can't bring it down. And he's very motivated and he tried all of these things himself. So I said to him, and he had been hesitant. And I said, please try this. It's 15 days. Anybody can do something for 15 days. Let's do it, And so he did it and, it was on Zoom. And so obviously his wife participated. Well, his wife came in for her physical before he did, like to follow up. And she kind of stole his thunder because she was so excited. I love those visits. She was so excited and she was like, oh my goodness, this was the best thing I've ever done. And she told me about not only had they completely transformed their entire nuclear family, but then she started telling me about how they were pulling in the parents. And she's like, I want my parents to like live a long time. And we have so much cheese in the Italian diet and all this sausage. And then she told me about how they were going to like bring them in and sit them down and feed them a vegan meal and tell them this is what you have to eat. And so I was like, whoa, they're older and you got to be a little bit more gentle with it. And so my suggestion to her was, and I've done this myself, I was like, just cook the food, just cook it, have them come in, have them eat it, they'll enjoy it. And then say, hey, what did you think? Wasn't it tasty? By the way, it was all plant-based. and now let's have a conversation. So I think you can really, really have this wonderful domino effect from such a small program that can be, so far reaching. It's fantastic.
Oh, thank you. Thank you for that. It's really, yeah, Bob.
Just one other quick resource I refer everybody to: Plant-Based Nutrition Support Group, pbnsg.org. And I see in the chat there any specific recommendations for online. It's not only online cooking classes, but online world-class speakers. You've got Michael Greger and Neil Barnard and Ted Barnett and other very famous plant-based speakers there. You've got small group meetings where people, as Melissa said, connect with each other across the country, across the world. To join and get initial access is free. For a small subscription fee, they can join and get access to even more. So pbnsg.org is something I tell all my patients about for sustainability.
Right. Thank you for that. Actually, go ahead, Susan.
Yeah, no, there was a request to repeat the name.
It got
I
typed
just
in.
typed it in the
Yeah.
chat.
Okay,
Yeah,
great.
that's the Plant-Based Nutrition Support Group. And actually, it's really interesting. You should mention that because just a couple of days ago, I got a message from someone who was in the last Jumpstart, who happens to be a professor of dentistry in Toledo, asking, because he had amazing results. He was so excited. His cholesterol came down. He's losing weight. He's never felt so good. He's about, I would say, 65, 70. And so he said, are there any supports in Toledo? And I said, I don't really know, but check out the Plant-Based Nutrition Support Group. And he got back to me today and said, there is a small group in Toledo for PBNSG. So that was really exciting. Yeah, I think PBNSG is a great resource.
Yeah.
And just to tag on to something that Mira said about making sure you get labs. And this is kind of a response to the question to Dr. Berkowitz. I think we should get labs too frequently. To me, the labs I call it motivational testing. You can't get it too often. I mean, people with diabetes are checking their blood sugar a couple of times a day. If you're dealing with high cholesterol, why not check your cholesterol once a month? Or if you're really making big changes, even more frequently than that. It may not be covered by insurance. I'm not sure about that, but I think people find that really interesting and really motivating. And it's just to get this sort of nice biofeedback. And Dr. Breakey said, and ppod.org, of course, that's the plant-based
Prevention of disease.
Right. Yeah.
Yeah. By the way, tomorrow's the last day for our early bird special, or the special for June, and for the extremely early bird for the InLive conference in Orlando in October, where Ted is speaking.
I'll be speaking there. So.
CME and continuing education for nurses and dietitians, and entirely evidence-based, there's no promotional corporate promotion at all, and it's very excellent sessions with respect to education for professionals. Anyone's invited, but that's another great resource.
Great, yeah, thank you for that. So it looks like we have run out of time. I'm going to see if Dr. Leibman has any final words.
I truly have nothing to add. That was very comprehensive.
Thank you for that. All right. And Dr. Friedman?
Those are my final words.
Your final words. Thank you, Scott. And Dr. Friedman?
It's been a wonderful discussion. I mean, it's all these great resources, great ideas, wonderful clinical pearls. Really appreciate all your insights.
Great. Yeah.
Can I just say one more?
Oh, sure, of course.
Because Dr. Breakey had this lovely phrase, and I have one that I read in medical school. It's an old Irish quote, and I say it a lot to my patients. It's very simple. May you live as long as you like, and like it as long as you live.
Nice. Okay.
Very nice.
All right. Well, that'll be in the recording. So for those of you who couldn't write that down.
I'm going to write it down.
And
Yeah.
I just wanted to add, Bob spoke about the video that he shows, and I show that same exact video. And so if you want to search it, search Make Health Last Canada, because it's produced actually by Canada Health. So that's how you'll be able to pull it up. I keep it on my laptop, and just like Bob, I show it, and I've seen it hundreds of times, and I still get choked up every time I watch it. It's 60 seconds long. It is the most convincing thing. And when I have husband and wife in the room, that's when it's really powerful, right? Because not only does it pain you to think of your yourself getting sick, but then your loved one getting sick, right? So I agree, Bob, make health last. Canada Health it's spot on.
Great. Yeah, I agree with that. Yeah, we use that too as well. So thank you all very much. And for those of you who have been participating in this, we'll send you a link in a few days with this recording of this webinar. And we look forward to seeing everybody again soon in some form or another. Thank you.
All right.
Bye-bye.
Should we all unmute and say bye?
Yeah, everyone unmute and say goodbye.
Bye.
That includes you, Scott.
Thank you.
Thank you. Yep,
Okay,
I'm muted.
thank you all. Bye-bye.
Bye, everyone. Thank you for joining.